Today, I want to talk about the growing number of medical malpractice lawsuits filed against Sono Bello. Patients across the country have complained about complications during and after procedures. One patient even described her liposuction experience as feeling like she was being skinned alive. And it raises a bigger question: has cosmetic surgery become too commercialized? Because at the end of the day, this is still serious medical care, not retail. And it leaves us with a lesson to always verify credentials, ask hard questions, and never rush the decision. As we get older, many of us notice a little extra fat, or sometimes we lose weight and we're left with some loose skin, which is completely normal. But sometimes you wish you could just get rid of it. That's exactly how Erin Schaefer felt. She had noticed some stubborn fat and decided she wanted to do something about it. And while searching online, she came across ads that many of us have probably seen.
Summer is coming fast. Get your best body now with Sono Bello.
She got in touch with Sono Bello and met a sales team that was so enthusiastic that they were borderline aggressive. They told her she was an ideal candidate for the procedure and helped her to book her surgery. And in January of 2024, Erin went in for her liposuction. So what's unique about the Sono Bello liposuction procedure is that it is laser assisted, meaning the laser helps break up fat, but the fat is then physically suctioned out with a cannula. And Sono Bello doesn't use general anesthesia, so patients are usually awake during the surgery. Erin loved the results so much that a few months later, she booked another surgery, this time for another liposuction and mini tummy tuck, which Sono Bello calls AbEX.
Introducing AbEX from Sono Bello. Remove fat and lose excess skin permanently in just one visit.
But this time, everything went wrong. When she came in for her surgery, Erin was given a cocktail of oral painkillers and an infusion of lidocaine. A little into the surgery, she started to feel the pain. And when she told her doctor she was in pain, her doctor told her to power through. But it got so bad that she was begging the doctor to sew her up because she couldn't take it anymore.
The pain that I felt was just unbearable. And I said, hey, I'm really feeling this. And he says, you're doing such a wonderful job. Just hang tight. I started crying and I said, please stop. I said, I can't do this anymore. He said, just take some breaths. Let's turn on some music.
Then, 2 days after the surgery, she spiked a fever. And a day after that, her pubic area was swollen badly. She reached out to Sono Bello medical staff who told her that it was normal and that she was fine. However, a few days after that, blood and fluid would spill out of her stomach when she stood up. So this time, she went back to the hospital. Little did she know that she was about to get the shock of her life. At the hospital, she met with her surgeon, Dr. Manuel Herrera. And he told her, yes, she definitely needed surgery to fix her wounds. So imagine her surprise when he then told her he couldn't do it because he was an obstetrician, not a plastic surgeon. And so he didn't have hospital privileges locally. But he gave Erin the option of driving to Orlando area, which is about 140 miles southwest of Jacksonville, where he had hospital privileges. That was obviously too far. So Erin had to go to the emergency room to get treatment and pay out of pocket. Sadly, Erin isn't the only one. Since 2013, Sono Bello and its surgeons have defended over 60 medical malpractice cases, and at least 4 of these lawsuits involved patient deaths. For example, Bob Burgess lost his wife in July of 2025, only 2 months after her procedure with Sono Bello. He said he knew something was wrong with his wife immediately after the surgery. And now Bob is seeking compensation from Sono Bello for the death of his wife.
My family's devastated by this. I'm in as much pain right now as I was 73 days ago.
Sono Bello has settled multiple lawsuits. Many settlements are private, so amounts and exact outcomes are usually not public. Other cases are still pending, dismissed, or disputed. Of course, malpractice suits by themselves are not proof of any wrongdoing, and there is always a risk that something could go wrong with any type of surgery. Sono Bello and their lawyers have come out to defend themselves.
13 over 300,000 patients that have undergone this procedure. It is not, unfathomable that 13 patients would have a negative experience. That's really not the norm.
What really stands out to me about Sono Bello is their marketing engine. They have a great marketing system. They bring in and convert many patients by relying heavily on testimonials and before and after photos. Also, their pricing is lower than many traditional providers, with lipo typically around $2,500 to $4,500 per area, and AbEX roughly $9,000 to $11,000. And because these procedures are cash pay and usually not covered by insurance, the model, like many retail cosmetic chains, depends on high volume to drive profit. Unfortunately, in a high-throughput environment, post-op care may not always get any attention. So, as consumers, we must not be easily swayed by good marketing tactics, because ultimately we are the ones to live with the consequences of negligent care, sometimes for the rest of our lives.